Good afternoon, everyone. Alisa Haushalter, Director of the Shelby County Health Department. And on behalf of Mayor Strickland and Mayor Harris, I want to welcome you to the Joint Task Force update for Thursday. Today we have several people that are here. I'm going to give brief updates as I always do, make a few comments, and then Tiffany Collins with the City of Memphis is here to talk about testing events that are available to the public this weekend. And then Dr. Randolph will finish up with some additional comments and we'll open it up for questions. I want to start with really noting what's becoming more and more evident to me is that this is really the biggest peak that we've experienced with the pandemic, and it is at a very difficult time of year. So I really want to reinforce that it's a lot of anxiety and depression and other things that are related to the pandemic. That's not just happening locally, but that's nationwide. And that together we can get through this, but it is going to take each and every one of us to do what we can to reduce not only the transmission of COVID, but the impact of that transmission on our community. Not just limited to schools and healthcare systems, but also on our businesses and other amenities here locally. So it's critical that we take every step that we can as individuals and as organizations to reduce transmission. So again, I'm going to share some updates, and not only our regular updates, but a little bit more information around our additional interview tool and information we've gleaned from the last 300 or so interviews, those that happened in November. So we do know at the current time we have about 471 new cases on average over the past week. That is above our tripwire of 450 new cases per day, and our case rate now is 49.3 per 100,000. So that's been an increase over time. I want to talk a little bit about our death rate. We haven't given that data in a while. So I want to point out that our deaths, particularly amongst those who are African American, is at 56.8%. For white or Caucasians, our death rate has been 26.4%, or 26.4% of our deaths have occurred in people who are Caucasian. And then about 16.8% of our deaths have occurred amongst what we would call other, or races that individuals indicate themselves or others. Amongst our Latino population, about 84% of our cases identify as not being Latino or Hispanic, and about 16% identify as Latino or Hispanic. I wanted to share that today because as the pandemic has progressed, we know that communities of color have been disproportionately impacted, particularly by deaths. We know historically communities of color in Shelby County have a greater impact from poverty, as well as chronic illnesses, including diabetes and hypertension, which impacts one's risk of dying from COVID. But I also wanted to note that because we do have many more treatment options available, so I wanted to take this opportunity to remind people, one, of the importance of preventing the spread of COVID, but that in the event you exhibit any signs and symptoms, even mild signs and symptoms of COVID, it's really critically important to get tested and to connect with a primary care provider so that you can access early treatment that is available in our community. And as I said, Tiffany is going to speak much more in detail about some of the testing opportunities that are going to occur this week.